gotta open that too.
On which one? Simple?
Yeah.
We're doing chapter 10, and of course in your assignments it tells you what page you're stopping on. But it stops at page 494 is where we're going to on this tonight. This chapter has quite a bit of interactive picture examples. So half of this chapter is information and half is talking about client ranges of emotions and how to test for how a client's range of motion is or is not working for them. Okay. So, what do you think of when you hear the word bio? Okay, what kind of meaning comes behind that word? Good, dealing with living things. So, in this chapter, we're talking about the basics of human biomechanics. Okay, so bipedal locomotion on 2 feet, different than 4-legged animals. We're on page 469 in your essentials book. So, mechanics, both static and dynamic motions, those are both going to be discussed. And knowledge of how our body works to create movement is helpful because it will help us manipulate the body better if we understand how it works. So key point, kinesiology means the study of body movement, and it's the science of energy balancing grounded in anatomy and physiology, basically. It uses muscles as monitors of stress throughout the body, and we find imbalance, and then we work for figuring out the most effective approach. One second, I have them on the wrong notes open. There we go. Okay, so on 469, static movement is, static biomechanics is non-moving parts. Dynamic, we're talking about moving aspects or activities. All right, so how muscles, bones, tendons, and ligaments all work together to create movement is what, in the applications that we need to use for living organisms is what we're going to be talking about. And we're going to start out talking about force. And in therapeutic massage applications, we're going to be applying external forces to the body to make a change within those mechanisms. And the force that is generated by 4 different techniques: compression, tension, bending, shear force, and torsion forces. That's at the top of 470. Okay. A vector is the direction that the force is applied. So it could be downward. We talk about horizontal and vertical forces. It gives the example of 80 pounds of force applied in a downward direction, about a 60-degree angle, is going to result in about 40 pounds of a horizontal plane force, and slightly higher, 69 pounds of force at the vertical direction. Because if we're applying it downward, it's going to have more impact in the vertical plane. The elements that can relate to massage and force are pressure, inertia, acceleration, speed, resistance, and effort. Inertia is basically a reluctance of something to change its state of motion. So it's going to try to stay at rest unless some external force creates change. Okay. Acceleration is the rate of change in the speed. It also can be proportional. So a larger force is going to cause more acceleration than a smaller force. So it's be proportional. Just like if you have a 50-pound child and a 300-pound adult male, if you do the same amount of force, there's going to be less acceleration against the adult than against the child. You're going to have to use a greater amount of force to have equal amounts of acceleration on the adult, right? Okay, and same thing when we're working on someone who has osteoporosis or, some kind of dysfunction or disease that it has compromised the integrity of the tissues. Then we have to use less force throughout the whole session. Resistance kind of follows Newton's law. For every action, there's an equal opposite reaction. So when we place force on the floor, when we walk on it, the floor is providing resistance to our feet. And we can feel that on different surfaces of floor, right? Concrete, much more dense, harsh resistance than if you're walking on foam padding, for example, right? We can kind of bounce on that. Our body's not absorbing so much of an impact. Okay? So when we're working on athletes, for example, they're going to normally have denser tissue. So they're going to provide more resistance to our force. So you're probably going to put in greater amount of effort to create the same amount of change in their tissue than someone who has a lot of adipose tissue or who is not that active. So their tissues are not so thick and dense. So we have to adapt what kind of application of force that we put on each client. And we get feedback from them, but also some things that we can see or feel also tells us what we might need to adjust our approach, right? Okay. And effort is just how much force we apply to overcome resistance, and in this case in the tissues, the soft tissues of the body. Now, the box on page 470, practical application, talks about it's always more efficient to go uphill than downhill. That might sound like an oxymoron, but in our case, we don't want to waste our effort by putting it out into space instead of into their tissues. So when we go downhill on the leg, 40 to 60% of our energy is lost into space. It doesn't go into their tissue. But when we come up the leg, all of it goes into their tissue. Some of it in a vertical pressure force and some at a horizontal. So not only are we working distal to proximal, but we're being more efficient in their tissues are absorbing all of our force instead of we're losing some of it. And that's why we just, especially with oil, right, we just slide right off. We're warming up their very superficial layer of skin, but we're not affecting the musculature underneath as much. So let's be green with our massage and not be wasteful of our energy, right? All right, levers and fulcrums. Levers help us use less effort to move heavier loads. That's think of, there's different levers, we'll talk about each kind, but it makes it easier to move. And a lever is rigid type of mass, and it rotates around an axis, which is called the fulcrum. So if you think of a seesaw or a wheelbarrow, for example, those are different classes of levers, and they assist you. You put something in a wheelbarrow because it's heavy, right? And you've got to go from point A to point B, and you don't want to hurt yourself with lots of strain and sweat, right? So you put it in the wheelbarrow. The lever lets you lift it much easier, roll it to point B. So that's essentially what we're talking about. And the body is basically a big series of interconnected levers, different types. For example, the elbow can be a fulcrum, and we can have the load in our hand. That's very common for us to carry loads in our hand. And then we have the elbow as the fulcrum. Okay, so let's talk about, there's advantage and disadvantage to different classes, but mechanical advantage means there's less effort to move something. Disadvantage, you're having to apply more effort. And so how much is going to depend on what type of lever and, of course, the amount of load that you're moving. There's more stability if you have a mechanical advantage. So you're stronger, more strength, but you lose speed. Mechanical disadvantage, you can move quicker, but you are having to use more, you lose some of the strength. Okay, so joints are our fulcrums and bones are our levers. So explaining the disadvantage and advantage, when we have the effort closer to the load, that is at a disadvantage. So if you pick up the handles of the wheelbarrow right next to the bucket part, you're going to use more effort to lift than if you're at the end. Okay, so your effort is closer to the weight, you have to use more force than if you're further away. Then you have more advantage to just tilt it a little bit, right? That's basically what this is talking about. And so it uses the example of trying to resist someone lifting or doing lifting their foot up against resistance. You have to put forth more effort in which of these scenarios, A or B? Who says B and who says A? Who's my A people? Which one uses more effort? To resist them raising the foot.
More effort to resist.
I'm gonna go
That B.
Okay, let's try it and see. Let's try it and see. So everybody get a partner. We got 7, so
Okay.
I'll be somebody's partner. Come on, Mr.
Alright,
Jones.
so we're resisting them bringing their foot towards
Yeah,
us.
so you pick what you're gonna do right under the knee or right under the ankle. You get ready and then you tell them to lift while you resist and see which one is harder for you.
Alright.
Mommy. Not beyond you.
Okay, yeah, definitely. The knee was the hardest one.
I'm sorry.
Like, don't kick me in my face.
Well, you made my knee now.
Like I did. No, she's like, okay, my knee hurts. I'm just kidding.
Well, yeah.
It's not a competition.
I know.
I don't need it.
No, it wasn't. I just made my knee.
I don't want to cry.
Okay, so here's
Just pop something in there.
right.
Okay, we want to do one here and one here. One hand for the place. You need it all your fingers and toes that way.
Yeah.
So A is harder. Okay. say?
Well, if it's more difficult for resisting, I said B.
That was it.
B was way more difficult.
If
than
I'm the
resisting.
resistor, I'm the one that's resisting,
Yeah.
then it's,
B was
Then it's
10
more.
Yeah, we're talking about the person
But the-
resisting, not the
Not
person
the-
lifting your leg.
okay, then yeah, B.
B hands down.
Yes. So B is which one? Advantage or disadvantage? Disadvantage, yes. A is mechanical advantage. And so now we got that, right? We want to be, but there's different types of joints in the body, so different classes of levers. So, first class lever example is lifting your head off your chest. Like that. That's a first class lever. Second class would be standing on your toes. This is not a true second class, but it's the best example of it the human body has. First class levers are the most common in humans, and it allows for rapid movement with minimal shortening of the muscle. And I showed you about biceps already with something in the hand, and the elbows, the fulcrum. So there's different examples of these different classes. The weight provides the resistance, right? In general, whatever we're, just like if you're working out and they have ankle weights, they have wrist weights, right? It's providing more resistance at that location for the muscles to work against. Third class levers, the effort is applied between the load and the fulcrum, and most of the body operates with the third class system for that reason. So 2 is the most uncommon, 3 is the most common in humans. And I have an example pulled up of the different ones that I liked. Of examples you might be able to remember. So the wheelbarrow one this is the one we don't really have in the human body. It's common elsewhere, but not in humans. So first class is similar to scissors or pulling a nail out with a hammer. Your fulcrum, the load or resistance from the nail, you put your effort up here in between. See, in between the fulcrum and the load or resistance. Same thing with the scissors. You have the fulcrum. This is going to resist. Let's say this is a piece of wood you're trying to cut. Your effort is here. Okay, and then in the body, most are third class, as exhibited here with the elbow and the load in the hand. That's the most common that we see in the body. Okay. So do be aware of levers, fulcrums, mechanical advantage, disadvantage, and the most and least common classes of levers. Those are important points. Alright, next we're going to talk about balance, equilibrium, and stability. Balance is the ability to control our equilibrium. And equilibrium is when all forces on an object are equal. So we can have static and dynamic equilibrium. Because when we're walking, our body tries to balance our head parallel with the floor. Wants our eyes to be able to see where we are, so we're oriented. So to achieve balance, we want to maximize our stability, which is our resistance to change or disturbance of the equilibrium. Center of gravity. This is wherever the weight of our body is evenly distributed in all directions. And our body has to constantly change because we're constantly moving around. Our center of gravity can change. If we bend over to pick something up, our center of gravity adjust. And we feel that when we make the movement, certain muscles stabilize us, right? And different muscles will have to put different amounts of force to keep us balanced, right? And go on one foot. We pick up a load on one foot, we transfer it to the other foot, right? Helping somebody do something. The whole time our body is working to maintain that as good as possible, that equilibrium and stability based off of where our center of gravity is. So this is a type of homeostasis, a dynamic homeostasis. Alright, principles of balance. Our center of gravity needs to be within our support, our base of support. So, and our base of support, the larger it is, the more balanced we can be. And if we are going to have more force come towards us, right, pushing, shoving, catching something heavy, we need to largen our base of support. So if someone's going to toss you a banana, you might take a small step back. You might just look up. If someone's going to toss you a bowling ball, what are you going to do? If you catch it, you have an automatic A in anatomy. We're going to try to catch it. What are we going to do? We're going to stand like this?
We're gonna go with it.
What are you going to show me what you're going to do?
You're gonna bend it and you're gonna catch it, but go with it.
Are you
That's
gonna
what
do-
I'm get.
What are you going to do? Are you going to do this? What are you going to do? Catch a 10, 12-pound bowling ball. You're standing, you're not sitting.
So if it's coming to me, I'm gonna try to brace myself and kind of,
Okay.
like she said, kind of go with it and catch it.
Whatever your choice is will increase or decrease your chance of staying still and not getting knocked down. So, does anyone want to stay like this? No takers? Loosen, bring your knee a little bit?
Yeah.
Okay. You're going to fall.
Okay, I will.
Who wants to go like this or like this?
I wanted to know it's an option.
I'm coming with options. So
I thought you
Carly
had
fell
stayed still
over.
or bouncing.
Pick her up. Okay. So you want to enlarge in either some direction, make it bigger, so you are more stable to take on more weight, right? Okay. So remember that. In order, when we have oncoming force, right? I mean, boxers, they're gonna take a stance. They're not just gonna stand there. I'm gonna get here. I'm gonna shot. They're gonna enlarge their base of support so they can take on more force and try to resist it. All right. I'll be watching that question for Carol. All right. So, different principles of balance. We have different in the seesaw. Here's the fulcrum. The axis of rotation. If we have someone who's lighter, they need to move which direction? Closer or further from this axis of rotation? Further, yes. If they move this way, it's going to go whoop, right? So they move this way to even out how many pounds are thought to be, make it more equal and stable. Okay, those are parallel counter forces. All right, posture. Our postural muscles help us to stay upright against gravity, and that changes with movement too. And so, when is the only time our postural muscles get to rest? When they down. Yes, they don't have to fight gravity. Okay. Why is posture important? Someone who's not on the fourth row has to answer this question first.
You said because of the stress that we put on the other parts of the body.
Okay, so the body always wants what? What's our first word we learned in quarantine? Homeostasis. Yes. All right. So he's free for this next question. Ooh, y'all ready to be quick? Okay. So it wants homeostasis. When we what happens? Body part.
We're out of line, we're out of balance.
It has certain ones have
And then
to
contract.
pull
Yeah.
to still keep us upright, even though we're no longer evenly distributed weight. We have more weight on this side of the body. This is compressed. This is lengthened. So we got, right? We do that every day at our 8-hour job, and then we drive home too. Right? Armrest, and then we get in our lazy boy, and we're on our, and then we fall asleep. Dang, we've been in this position for like 12 to 16 hours. Over time, what develops besides trigger points? we have weak areas.
Sometimes certain failure, like.
Well, yeah, it can eventually pull, right, if it's constantly, okay? And we have certain careers that put us in, unless you're super aware of your posture, just that, and certain chairs are made awful for posture. But they put you in a bad posture position if you sit the way that it is supposed to have you, right? And because you'll eventually work on people who they fell asleep in their lazy boy or their recliner, and so because of that we have this crick and we have problems because it's not supporting their body correctly. Okay, so we should have our pelvis in a neutral position so that there is equal stress on it. On both sides, weight evenly distributed, it should be level. And then of course when we do walk it will move, but when we're still it should be level. So that's another reason why 85% of your weight is on the one side. You tilted, right? You tilted.
I did that when I was young, but.
Right? And then babies, let's tilt it off and put a weight there. And hold it while it's trying to scream and fall and it's not holding itself. So, I was so happy when they were walking. I didn't have to hold them no more. So there's all kind of life moments that happen that put us in a not ideal posture. But posture is important. And of course, don't forget the lordosis, the kyphosis, the scoliosis, those things that alter. But the curves that we have normally act as shock absorbers for our normal movement within gravity in an upright position. At birth, our whole vertebral column is concave anteriorly. This is called a primary curve, and that's because we're inside for a long time as we develop. We cannot stretch out. We're not walking against gravity for a long time. It develops over time, and that's why our bones are more, everything's lax, and as we get older, it starts getting harder to create our adult skeleton. So, the upright position, all the posture muscles of our back, around our hips and legs, everything should stay in alignment ideally. So ear, shoulder, hips, knee, and feet when we stand, when we're in proper alignment. Chiropractors will check you. Sometimes physiotherapists, massage therapists sometimes will check you to see, without them talking to you, what's going on with their body. Okay, so we have anti-gravity muscles. The on the hips, the knees, the neck, and along our trunk. What muscles in our trunk do you think are involved in posture? Abs, okay. Yay, you win. That's it? In the trunk region of the body. Good. See, another easy one. Probably just slacking. A little bit. Everything will react, but what helps keep us upright? So our neck extensors, right? Our knee extensors, okay, help keep us upright against gravity. Yes, hip muscles, the hip extensors, okay. So how we assess, there's different ways to assess someone's posture. You can use a plumb line, which is basically just some kind of quarter string that has a weight at the bottom, so you hold it vertically. And you want to see how level their ears, their shoulders, their hips are. Generally we'll check shoulders and hips. Those are real easy to see, usually on people. You can also use a grid chart like I have here on the wall. You can have them stand against behind you, and you can see where the lines go. And you can count and see, which shoulder is higher or lower on the chart. So those are different ways as a reference. And the weight, of course, makes it perfectly straight in gravity. Okay, let's talk about the kinetic chain. The kinetic chain is basically integrated functional unit. It's a network of our body systems that are involved in our movement as humans, and they're linked together. So we have the myofascial system, our joint system, and our nervous system. They work interdependently in all three planes: the frontal plane, the sagittal plane, and the transverse plane. You learn those, remember those things? Okay, whatever system is not working efficient will cause compensations in the other systems to adapt to whatever's going on. And this leads to stress in the body and to dysfunctional patterns if it happens long enough. So that's why we want to try to take care of injuries as fast as possible, try to rectify it. And still, even if we try our best, it's still, like I have someone now, they've broken a bone in their foot, so they have a boot. So they're trying to find shoes that are as close to the height of the boot, but it's not going to be exact. And still, that's not bending either, so there's still going to be adaptations that the body makes naturally. And we've got to work on those things, keep the function as close to balance as possible. So what happens is any pattern that involves acceleration in the body is going to use concentric muscle action, and then we'll have stabilization happen with isometric muscle action, and then slowing down or decelerating other body parts happens with the eccentric. actions. So there's all kind of actions that happen around all our joints, and it's all related to the sensory information that gets sent through, and the nervous system relates from the brain to the body parts what to do, what not to do. So when everything is working good, then we have pretty much good balance when they cooperate. But let's talk about some of the main groups that make this up. We have inner and outer units. Inner units are intrinsic muscles, okay, and they usually function at only one joint. That's important. And their main function is usually stabilization of the joints. So intrinsic at one joint, stabilization. They typically provide stability to the core or peripheral joints. And most of them have a proximal attachment near the spine or onto the spine. The outer unit on page 478, these are called our movers. They're usually larger muscles. They're more superficial and extrinsic, which means what's extrinsic mean? Outer, just like they're called the outer unit, right? The outside surface is closer to the outside or more superficial. And they're normally larger, and they normally move the trunk and the limbs, is what I usually do. So our external obliques, our erector spinae, our rectus abdominis, all closer to the outer surface of our organism. Dysfunction in our muscles stabilizing our SI joint typically lead to SI joint pain, sacroiliac pain. Erector spinae, psoas type muscles, they will, if they don't have proper function, they generally lead to low back pain a lot of times. So it depends on where they're attaching. They're not functioning properly. That will give us an idea of what muscle groups we need to focus in on. And I know this is a lot of information if it's new, so don't worry about memorizing all of it. Just get the key points. Okay. All right. Hip rotators, things around the pelvis, they'll usually have either SI pain, lumbar pain, or pelvic, sometimes knee, depends on how long it's been happening and where the compensations happen. And a lot of times it'll be from weak glute muscles, which causes very tight hamstrings. So you want to start pairing together symptoms that people report. Oh, my hamstrings are always tight. You know, if you go to do the extension, they can't. They probably have weak glutes. So you have to think about that, and we'll go into some of the testing at the end. Okay, so for postural stabilization, it occurs in the soft tissues of the body, and this is where we can have dysfunction or compensation patterns occur. Because we have three-dimensional body, it's got to stabilize in all three planes against gravity in an upright position and provide that bipedal locomotion with our two legs. So a lot of times, if someone has, for example, their hips are not level, right, like we want ideally, we have a hip that's raised up, it's going to cause compensation patterns near C7 and T12, where we have major bends in mobility in the spine to compensate, because it's going to adjust to keep our head level even though the hip is off. It wants to keep it as straight as possible, so it's going to make those adjustments to do so. And sometimes it can go down the leg, of course, the hip area will also usually have some issues. So when we assess somebody and understand what's working with and or against different muscle groups, it helps us to be more effective, quicker, to help them out and lay out our treatment plan for them. So next, let's talk about sitting, standing, and bending. Is this good? Or this?
Second.
Which is called
Correct.
good. I'm glad you know that word. So squatting is better than hip bending. It's more efficient. You can keep your weight more even on your feet. You're taking on a load normally too, right? And so that allows your pelvis to stay neutral, weight evenly distributed on both feet. And you want to try to keep most of your feet in your heels, not on your toes, not on the balls of your feet. Never forgetting that again. And we want to lead most of our movements with our head, because our body wants this level. So we don't want to do this. You want to keep your head up. That's the other tip for lifting heavy objects. So, when we sit, as it shows in the picture, we still want to, when we go to get up, we still want to lead with our head. So we lean our head forward, more straight, up, and then the rest of the body just lifts the body upright. So we go from sitting position to standing out of the chair. Not, we want to lead with our head with where we're going. And that helps keep everything in alignment to head over the shoulders. Alright, locomotion. Walking. Okay, so bipedal locomotion, which just means moving with two legs, that is hardwired into us for wanting to do that from birth. Learning how to do it is trained, it's taught. But humans want to stand up and move that way. So that's important, those two things. So 479. When we are standing and walking, our center of gravity is around our pelvic area, around F2. And the body wants to move by using our head, not with force, to lead all of our motion when we're walking and standing. So those are important things to remember. And there's a whole lot of things that have to happen in coordination in order to let this happen. So we have flexion and extension of our hip joints when we're walking. One is extending, one is flexing. Right? And then it's switching. Also, we have our arm swing goes with it in opposite directions when we're not stressed or holding something or walking strangely. A normal walking gait, we use the arm swing with it, which rotates the spine a little bit. Our shoulders is going to flex and extend as well a little bit. And so I need 2 volunteers. Okay, TJ, well, all the way in the back. Come on. All the way in the back. Come on. Come on. You'll be next. Okay. Okay. So first, we're going to, you can stay right there. Sorry. Well, back up to like April's level a little bit. Perfect. Okay. So we're going to watch TJ walk normally.
Come on.
No arm swing. Where's your arm swing?
I don't.
You don't?
I don't know where my arms are.
That explains some of your hip issues.
Exactly.
So let's attempt to walk. Okay. Look at there. There we go. Okay. Now, show me. You just broke your arm. It's in a sling. So automatically there's a little bit of adjustment. It's not huge. And to a normal person they won't notice it. But did you notice any change? Any little changes that happen? No? Okay. Sherelle's turn. She might do it a little bit better, I don't know. Alright, so let's do a normal walk with your hands out of your pocket. Let's do some arm swinging. We'll pretend we're not looking. Nobody, oh my gosh. Who uses their arms when they walk? Nobody, okay. This is an epidemic of hip issues. Okay. Okay, so give us the arm swing. One of your arms is in the sling.
Swing.
Yeah. Okay. There we go. That was great. You saw it happen mid step. What happened when she put her arm up?
I thought it was a little bit harder.
Yes. So see, that was perfect. You knew exactly what to do. Good job. Okay. So we see the adjustment to the body pace from when we walk normally. Up we're supposed to. The arms well. And then, we get injured. Your body shortens one of the steps because the action is not happening. So it's not adjusting here, which affects this one, which automatically affects the opposite hip and shortens the twist as well. A lot of changes, and that's why now you'll know when someone gets a boot or a sling, the dysfunctional pattern spreads throughout the body, unless they are bedridden and they're not moving at all. It happens. Plus, then you start doing everything with one arm. This one is probably the most likely one to get hurt, your dominant side. So your weak side has to go grocery shop, cook, all these things that it wasn't doing before. So that lets you see a little bit of, because the body counterbalances, it wants to keep the head straight, it wants to keep everything in a line, and when something changes, everything else adjusts automatically, but it happens. And then the longer, 6 months in a cast, long-term problems. Okay, so now let's talk about the gait cycle. So the cycle of starts, and that's that whole rhythmic alternation that happens at all of those joints we just talked about. The legs, the trunk twist, and the arms propelling forward, whatever weight that we're moving. So it starts with the heel of the foot striking the floor, all the motions that happen until we do that again with that same foot. So we have, if we're watching the left leg, we have the heel strike, the stance of that foot, heel strike on the other side. We have a little bit of a double stance when both legs are touching the floor at the same time. The rest of it is called a swing. We're moving the leg not in contact with the floor. Stance is when the foot is touching the floor. Swing is the rest of the movement. Okay? So that's why it has different legs highlighted. If you're following the left leg, then it starts with the heel strike. Your hip is in a little bit of flexion. You go to stance, then it goes to extension, swing stage, heel strike. Okay, that's what the gait cycle is talking about. And typically, so I want you to know what stance is, double stance, and swing. That's the whole gist of it. What is double stance? Both feet are on the floor. Good. So about 60% of the gait cycle from heel strike with the same foot to the heel strike is a stance phase. The other 40% is swing. That's on average for walking normally and swinging your arms and not having any injuries or any, too self-aware nervousness of people watching you. So normal everyday stance. Let's see. Alright, so I'll just go over one more time. So we have flexion and extension at the hip, which causes rotation of our lumbar spine a little bit. The cervical spine rotates in the opposite direction of the lumbar spine, and we have the arm swing. Okay? That all happens without us thinking about it because we already learned it. And the limbs move reciprocally at the same time, and it flows. And all of this is to counterbalance our weight and gravity while we're propelling ourselves forward. Okay? Okay. Let's talk about muscle firing patterns on 494. So it covers degrees of, in each area of hip, knee, and ankle, what muscles are working, so you can look through those pages to get a little bit of a better idea of what's actually happening. But for now, we'll look at 494. So the general function of muscles is acceleration, deceleration, and stability. One of those is what a muscle's doing at all times. And activation sequence is used sometimes is the newer term. Sometimes you'll hear firing patterns. So the newer term is activation sequence. And that is prime mover first, stabilizer second, and synergist third. That is the ideal order. When we have disorder in the body, something's very tight and it's not doing its job all the way, then we have reciprocal inhibition that happens. And that is that the tight muscle causes less nervous system stimulation, with a decreased blood flow, decreased nervous system flow, all those things, decreased activity. But the most common thing that happens when we have dysfunction in this pattern is a synergistic dominance. So the muscles that are synergist with the tight muscle that's not functioning properly try to take over. They're supposed to be the last call. They take over. They're not used to being in limelight, carrying all the load. They tire quickly. They get tired quickly. They fatigue. And it causes a disruption in the flow of the way the body moves. And it usually results in a more awkward motion. And it's not energy efficient. It takes more effort. So it can look very awkward. What is the most common dysfunction that you see usually when you're walking around or on your table? Pronation, yes. What else? Have you seen any dysfunction? Yes, you have. I have seen them with you in here, so I know you've seen some. Lack of hip extension, okay. You have one? I know you see dysfunction. What is the most common dysfunction that you see in people? Hyperextension of knee, people like to stand with locked knees instead of slightly bent knees. Mm-hmm. Psoas, pecs. Yep, very good. Hmm? Oh yes. Yes, yes. Finally someone said it. Good.
What did you say?
Kyphosis. Okay, good, good, good. So, so for tight pecs, if someone has extremely tight pecs, what's something else they're gonna have in a different muscle group?
Their neck and shoulder. Like right through here, big fat.
Okay. Traps, erectors, lomboids. So which way are we gonna work both muscle groups? What are we gonna do with the traps and erectors? Which way is the best answer for what you should do to help them? We don't just do this, that's not it. Bye.
What technique?
See?
Not too complicated. What direction should we work on traps? They have tight pecs. We want to start them face down. So we start them face down. Which direction is most effective for fighting the tight pecs? Okay, okay, I can see. Good, yes. Who did not understand what she meant? Okay, so stand up. Okay, so we have tight pecs. We have what? What's that here? Tight traps. Why are they tight? They are over. What do you mean? They're over. Right, but what happens to them?
That posture.
Are these tight?
Yes.
How are they tight?
They're K4.
What and tight?
They're what?
The muscle length is what happens to the muscle?
Short.
They're short and tight. What are these?
They're long.
Yes. They're long and tight. They're overextended.
Okay.
When a person is overextended, are they stressed out?
Yes.
Definitely. They're still trying to hold this up back here, but these are pulling so hard. These are losing a little bit. Okay? Kyphosis. Is it painful?
To some people it's not, but it sure better up. They're like
If they think it's not, what happens? Talk about it.
their bodies adapt to exercise. I mean, it's
Yeah, but what
compensating
system,
for
what system is highly dysfunctional if they don't feel pain yet? Yes, the nervous system has reduced function, reduced sensitivity. They're going to have pain at some point. Cause, right, we're not supposed to be like this. What else is compromised? What else is reduced?
Your lower back is flat.
Yes. What else in the thoracic area? Okay, that was good. Abdominal compressed, but that's still not in the thoracic area. Okay. What else vital for life is compromised? Your breathing capacity is reduced. We're compressing it. We're already shallow breathers. We already don't belly breathe. We're compressing our lung capacity by like 20-25%, depending on how much, right? We're short this way and this way. Two planes are shortened. We can't breathe as deep, which means we can't get our oxygen levels reduced. Multiple systems become affected that people don't think about. Digestion issues, compressed too, and it's not getting oxygenated, and it's not getting movement and blood flow either. And then we sit, oh no, all day long. And then we get in our car, and then we get in our recliner. And we see why we have people that look like this when they stand up and they go to their people. That's why. So we're going to try to help that. We want to open up those awfully tight pecs. We want to anterior to posterior with the strap. So you want to do, you can still do pressure this way up the back. This will be lighter this way, deeper this way. We don't want to lengthen the overextended straps. You don't need to make it come this way more. It feels good momentarily, but it's not fighting the battle that their body's fighting. So we want to open the chest so we can try to put those shoulders back on the ears. It's not going to happen in one session. So we want to try to move this back. So we're going to try to help open up the body, increase oxygen, blood flow, reset the bones back where they came from a little closer each time. So then you can see that progress, alright? When we're fighting these compensation patterns. Okay, any questions so far? Awesome. You guys are going to ace your next practical, aren't you? Okay, so,
Actually, I do, and I mean, it's a little off topic, or it still goes with massage and stuff. So I had a client, they are skinny, but it's not like the muscle tissue is like jelly. Like, I mean, there was no,
soft.
it was, yeah, and it was, I mean, like, they're tiny, but they, and I mean, not to work on them, they don't do like a lot of exercise. They're just very tiny, they don't eat a lot. So when literally working it, it felt like all the muscles were atrophied. How did you go about, like, I was able to work on them effectively, but at the same time it was still one of those where it was like, okay, well this area is hurting, and I'm like, there's nothing, there's like no tension, there wasn't even hardly any tension in any area, it was just completely atrophied.
Okay, so what did they say was hurting? This?
That neck, like, wanted like 30 minutes of neck work.
Okay, did you check SCO?
I did, and I
And it was
actually,
what?
yeah, it was, I mean, it was tight through there, and then I started asking questions like what I did all day, and then we're sitting at computers and desks and stuff. But in that instance, just like even overall, especially when I was trying to work the back muscles, because the back area was tight, it was like, I could barely get mechanical, like trying to work like that. It was like very much, I'm like, even when I'm pulling the muscles back, it's still, I was like,
So were you moving her limbs to go with the motion?
this one she was face down, and no, not on that particular one. When I was doing passes, because that was when I was really working, focusing on his back, and especially right in through here.
Okay.
So I went from,
So when they have not a lot of muscle tone, you can still be, you're still effective. It's gonna feel different. Because I had somebody ask me last week about people who have been very large and they've lost a lot of weight quickly and they have that extra thick skin. It's hard to feel what I'm looking for. They said it feels good, but I don't feel good about it because I wasn't as sure. So that takes time, but with working with them, what happens is the muscle fibers are super thin and small, so it doesn't feel like a classic tight, and they're not using them very much. So there's not a lot of bulk there. But I guess what you need to do is, what I would do is I would do some kind of like myofascial movements where I'm grabbing the muscle in the fascia and mobilize the joints in the limbs with that.
Okay.
So it's kind of squeezing it for you, and it can give you a feel. And if there is any tension within there, you'll feel it bump through, and then you can pinpoint your emotion.
Okay. Yeah. That's one thing that's like, I
Okay.
was working on like the closest thing that I can compare it to is like when I'm working on April right after she was having her surgery and stuff on the way that way. So like that's exactly how it felt like. All of it.
Mm-hmm.
But it's
What about when you get a heavier person?
Mm-hmm.
When you're trying to move it to get to it,
Mm-hmm.
it just keeps pushing back. I don't know.
No, I know. That's not inappropriate. Okay, so give me a body part area, for example. You
Like
have
they
to.
want you to work on your glutes, and then you're trying to work on it, it keeps like pushing back. You're like,
Well, it just says resistance. So you need to use a more pinpointed approach once you find the tension areas. You can still move the limbs to make the muscle contract so you can find it where it's the thickest and the tightest. Pinpoint it and then do forearm, do elbow, stand back and put that fist in there, hold it and then do the leg, So it's gonna, again, it'll be moving under your force, and you can feel where the tissue changes are at.
we have a different.
Yeah, that's why I don't like you guys to work on the same people all the time. Like you need the different body types, because you're here to ask questions. That's the best place to get new body types. It's like, whoa, that was a learning experience, because it is different. All kind of shapes, soft, hard, thick, smooth, bumpy. Health conditions thrown in there too. I'll clarify that later. If your face is for what I said, I think. Okay. Was it? Okay. I thought so. Okay. So, synergistic dominance. Alright. So, we talked about decreased nerve stimulation, activity there. Also, when we have the dysfunction in the sequence of the muscle patterns, it alters our joint alignment too, because of the tug of war that's happening with the different muscles. The muscles that are normally a little bit tighter, now it's switching. Those muscles are not working now. They're kind of staying still. So there's all kinds of things that happen. Okay, so now we're going to talk about or look through some of these protocols that you can do. Alright, so basically what it's saying is you need a control group, a muscle group that's your control group, to refer to against your test, what you're trying to actually assess and test. So that will be the one that causes a reflex response to your resistance. So if it's going to depend on what the pattern is. First it talks about gait issues, kinetic issues that are patterns between the shoulders and the hips are the main ones. It could also be in the arm flexors and the femur, opposite side. So just depends on what kind of pattern that you see. So the first one there on 10.2 is contralateral flexors. So it is, you're going to test the opposite quad, basically the hip flexors here and the upper quad attachments. And you're going to resist this muscle group as well as the arm extensors. So she has his arm up and his opposite leg up, and you are inhibiting one, the arm, and then you're testing to see what's going on with the leg. So you test, and you can do both sides. And so she's going to test by inhibiting the extensor on the tricep area, and then you're going to do the opposite arm, because when we walk, it's the opposite leg and arm working. And like we saw when we put the arm in the fake sling, you get little adjustments that happen on the opposite lower and upper limbs. So if everything's working well, you're looking to see what's strong and what's weak. So whatever cannot withstand the resistance is the weak area. So you want to strengthen the weak area, and sometimes if one is exponentially strong and the other one's weak, you want to relax that super strong one and try to build up the other one. And you can, give them exercises to do, obviously, if it's very weak. Okay, but sometimes it'll be weak from being overextended, like the traps. They're tight, but they're weak. They've been weakened because they're over lengthened. Okay, so let's do a little bit of this on the table, and then we will go into business. Sound good? Or do you want to wait and do this later when we're on the table?
Is that what we're doing on the table?
It's one thing that we do. You want to stand and do it?
What are we doing on the table?
We were just going to be clothed and test muscle groups. You don't need sheets right now.
Why don't we just wait and do it all at the same time?
You can. Yes? Who wants to do it now? Who wants to
I'll
do
do
it
it with a
later?
group test. I'm neutral.
Well, we got 2 neutrals out of a group of 7. So that's brings it down to a 3 of I don't know.
Okay.
Who wants to do it later? We got 4 neutrals. Okay, no problem.
Let's do it.
So let's do it then.
Let's do it.
Everybody else is Alright.
I'll be more than happy to stand up.
I know, I just need
Why?
to get my butt on.
Alright, stands up. Alright, so what you're gonna do, you gotta get a partner, of course, with whoever you're gonna work with. If you guys wanna do it standing, I think you might be able to. It's gonna be more difficult though.
I am not that coordinated.
Right, okay. So the people who wanna be tested first, lay down. I need 3 of you to lay down. 3 to lay down. Alright. So you're in a supine position. You're going to test the left arm first. Their left arm. Okay. So you're going to resist them coming down towards the table. You tell them when to resist when you're in position. We want to open our base of support. We're not going to go like this. Very good. Alright, tell them 1, 2, resist. The elbow should be slightly bent so they don't use other muscles. You want to push up while they try to push down.
Alright, stay on. Okay.
You're resisting.
There's still in college for
You're resisting. Then you're
on the thing, she was
Well, yeah, you can say, she's putting using her forearm to this. Your left forearm, Deborah. He needs his foot off the table, feet off the table. Bend the knee. You tell them when you want him to resist you. This way, he's coming towards his head. And you're pushing towards his feet.
I'm pushing towards his feet. Okay, gotcha. And I'm not pushing this.
Yeah.
Okay, I'm pushing this. Okay, which one has which shoulder? Okay, now let's check the opposite side. Opposite side on the elbow and the leg. Now. Okay.
So now you're gonna push your elbow towards the table while you resist.
You're strong.
Okay. Now, not 100% effort. We just give it a 60% effort. It's not let's do an arm wrestle. It's okay, and resist. It's just me. We're not trying to do anything. We're not trying to do Okay, so, and then check the leg too. The opposite leg. You're gonna check the same muscle on the opposite leg.
He's strong.
You should be able to play. You want to face what you're facing.
I want some.
You don't need to be twisting. You're gonna fall into.
Okay. That's it. Okay. A lot better.
All right. So now, which leg was stronger? All right. For everybody. Okay. Could be a little bit on this side, but okay. Now what about on the arm?
But that also could be, because that was my less than dominant hand trying to resist him. So I was trying to like bracing this way. That could have been an either or. He's pretty strong. He's equal.
Okay, let's do both at the same time.
Okay.
So let's have legs bend the knee.
Okay.
One. I only got two long.
Yeah, I was like, wait. Adonis is over here like, okay, we're see which one's really stronger.
You can tell they're both
All 4 legs. Get some Africans.
I'm good. I don't really want to do that.
Alright, so what we're going to do, I'm going to put my forearm here, and I'll put my other here. Okay? Like this. One, two, this, and there. Alright? Let's do the opposite side. Alright, do this. And down. Okay, so this was stronger than this side when we do that together. So that tells us that the compensation will be, which side will need to be lengthened.
Which side was?
This side. This leg.
Yeah. Would it need to be
Opposite.
the leg side or the?
So this side, this was stronger. So that means what tighter? Hip flexors here, are going to be a little bit tighter. So we're just working a little bit more. Stretching the hamstring. The back of the shoulder to the arm swing is going to be a little bit tighter. So you can learn the compensation pattern when you use it. It's like a gait check.
He's tight all over.
I mean, no, I mean.
Oh, no. You need it like that.
Oh, no, I
You
didn't
need it like that.
Okay. We know you all work on it. We've all worked on exercises.
Yeah.
Okay, so now, let's let them.
So we supposed to loosen them up when they're tight.
It lets you know what the pattern is in your body. The stronger muscle, the stronger muscle is tighter, short and tight. The weaker muscle is lengthened. It lets you know which way you work that. Or it's a gait check.
But like Adonis, he works out, so he's trying to be tight. I mean,
Well, he has denser tissue,
yeah.
but he still can stretch and loosen his range of motion should not be compromised. In an ideal world, where he stretches the exact correct amount for how much he can do. It's very hard to do with the family. These are not, but it's okay. It's not awful. Could be improved. Okay. Alright, so now we're gonna do, we're gonna check the hips. So we're gonna have them put both legs bent on the table. Right? Okay. You're going to have them, press their hands toward each other and chest like this. Okay, and you're going to resist while they try to squeeze their adductors towards the midline. Okay, open hands. Yeah, open hands. You got it. So you get, you're going to be trying to resist them squeezing together. You're going to be pushing them first. You're not going to help her squeeze together. You're going to resist her squeezing. You're going to try to separate her legs. Okay, I saw that.
Oh, he's strong.
I'm sorry. I thought I saw your hands like hold on it. Okay. Ready? You did it already? Okay. Now you're going to have them hold their legs together, their knees together, knees and feet together, and you're going to resist the biceps coming together.
Are we still praying?
No, you're not praying
We
anymore.
still have
Are
a
we
second.
doing elbows or?
Biceps. Biceps.
Like, so just like this?
Yes.
So then we just do there.
Make sure you stay on the
Yeah.
yeah.
Squeeze
Squeeze toward the middle. Just 2 seconds, y'all.
I know, okay, how long? Seriously. That's I was like, God,
rotate people so Callie will understand.
It said how long?
30 seconds.
That's a workout. I was trying to hold on now. And he's just like, it's not like when he was just like,
You're 100%.
Right, not from. Alright. We don't want to fall out when we're done.
We still have to get massage and stuff.
Alright, now we're going to have them relax their legs open or do it again and see if that changes the strength of the upper body. And just let them just kind of.
oh, okay, don't put your legs together. Gotcha. Okay, so.
Alright, 1, 2, 3. 1, 2.
Don't squeeze your knees at the same time. I saw them.
Don't.
I saw them.
Yeah, I'm just gonna do what April's doing. That's what April's doing. There's literally can be no force.
They're not as strong.
That's not as strong.
Okay, we took the leg.
Yeah, I was just like,
Sorry,
I'm just gonna
guys.
do it. So the first time I was like, did you notice she just
I didn't even move
just
him.
go right up.
This time, they're gonna have the legs with their hands.
You're dead.
Actually, but your feet on the table.
Okay.
Yeah, like this, okay? And you're gonna resist them again. You're gonna have them spread their legs. And you're gonna resist them coming in.
Work on.
Okay. This is weak.
Okay. You must stay seriously.
Game is off.
Alright, so now that you have an idea of what's weaker area and what's stronger, you know which ones you need to support and strengthen and which ones you need to inhibit by lengthening them out. You could do that and then you could retest at the end of the session. Okay? So let's remember the pattern that we can later. Alright, so that's the end of 10A. I'm gonna stop there.
So for.
Wait a minute, no, we got a couple more. Sorry. Go ahead.
So homework says to do all of the fill, I guess the fill in the blank. Do we have to do all of it since we're not covering all of it? Quit laughing.
Leave her alone. Go ahead, Kim.
I was asking. The correlate.
Yeah, because it only goes to the kinetic chain question. I'm looking. I'll just find them.
Oh, gee, that last one was cool.
I hate I missed
It's
it.
like, okay, go.
I just saw the laughter after it was
Sorry,
gone.
you had me crying. Lord.
Hey, whatever can help make your day a little bit better.
Okay. Okay, so we got a couple, we're almost done, but a little bit more. Okay, so basically, we're kind of figuring out what's going on with their body when we're checking with their patterns. So, any muscles that are too strong, we want to inhibit them so they can let go of the pattern that they have of staying tight and contracted. Could do compression, kneading, sometimes shaking when it won't let go. And then anything that wasn't able to hold strong against your resistance, we want to strengthen those muscles. And then we can, check later and see if we've kind of bounced it a little bit when we're done. Can reassess. Okay. So, last little bit talks about assessment based on biomechanics. Where am I at? So that's about talking about a treatment plan. There are, of course, variations according to what we find, and there's refluxes in the body, nutrition, influences, of course, the health of the tissues. So and of course, each joint has a certain movement pattern. It should be staying within its capsule. If we find areas that have adapted because of trauma or repetitive use, it could be, it might not be optimal for the body, but it may be efficient for what the situation is. If it's resourceful and nice and strong and has a range of motion, then we wouldn't want to reverse that because that could develop more negative patterns.
What picture were you
494. Assessment based on mechanics. I don't think I skipped anything, did I?
Oh no, I thought you were like going like 498 on that.
Oh no, sorry. 494. Assessment based on mechanics. So it's talking about intervention plans to meet a client's goals, supporting movement patterns that we find that are effective. It's still strong. It has a good range of motion, and then trying to work on balancing those that are not efficient, that are compromising the range of motion and fluidity of the joint. So that's also testing helps you see that how's the body does adapt sometimes to change. And so if it's an energy efficient, resourceful pattern that the body's created a little bit from optimal, then we want to support it and not try to eliminate it. All right, page 498 now. There's two types of information we can get when we are assessing a movement pattern. We can look at the joint angle when it goes into flexion. Is it the prime mover that's shortening? Is it stabilizing the body for endurance? Can it hold it? Is it tiring quickly? Or is there dysfunction, decreased strength, decreased awkward movement patterns happening? So the resistance that we apply to the lever, like we just did, we want it to be for advantage when we're doing it. So it gives the example of assessing a hip extension. We would resist at the end of the femur, because that's the furthest away from the fulcrum. And you want to resist slow and smooth and firmly. I should have went through this first, shouldn't I? Not slow and smooth and firm. And appropriate amount of resistance for the size of the muscle. So we'll do more resistance on a thigh than we will on an arm. Okay. Stabilization is important. Allows movement of the body while we can pinpoint a certain muscle or muscle group that we want to assess. And range of motion can be measured. I don't typically measure, I just eyeball it to see. But at PT situations, chiropractors, they may actually get out and measure your degrees of your range of motion. And it's going to, again, happen from the anatomic position. Is the movement and the plane that it's supposed to. So anatomic position is 0, and then you do your range of motion from there. And when we're assessing, the muscle should be able to hold against the resistance without pain happening or strain. So if it causes hurt or discomfort, then that is probably using other muscles to help, synergists, for example. And they should be able to do it for up to 10 seconds when you're doing a real test. 10 to 30 seconds, it says. But 10 is usually appropriate. If it's going to hurt or it's going to weaken and not be able to withstand the resistance. And last, let's see. Yeah, that's it. We're going to stop right there. All right. So let's take a break, have a snack, stretch, and then we'll finish up with business. Not tonight. You guys forgot. Surprise! That's a good surprise, finally.
Yes. I'm gonna cover
I'll
that.
leave it in my pocket.
I'm never like the person who wants to first.
That's enough to order out to eat.